Welcome, everyone, to Lessons from Healthcare Entrepreneurs. My name is Stephen Collins. I'm the CEO of Matter. Today's program is a collaboration with the University of Chicago, specifically with the Polsky Center for Entrepreneurship and Innovation and UChicago Medicine's Center for Healthcare Delivery Science and Innovation to share some of the journey that entrepreneurs are on. Thanks to Sharon Markman from the Center for Healthcare Delivery Science and Innovation, as well as Nina Merchant, Ellen Zitkowski, and Melissa Byrne from the Polsky Center for helping put this program together. So if anyone tells you that entrepreneurship is a breeze, you will know right away they have no idea what they're talking about. It is a rocky road with beautiful, wonderful high moments, as well as soul-crushing low points, often in the same day. For people who are up for this ride, it's an incredible way to make change in the world and create value, and in healthcare entrepreneurship in particular, to do something that matters. So during today's conversation, you will get a sense for what the journey's like. You'll hear from entrepreneurs about how they got started and what they learned and what help they've gotten along the way. If you're a medical student or a trainee or a student, you'll get ideas on how you can get involved in startups, and you should come away with ideas of how to get more involved in Matter as well. The University of Chicago is a partner of ours, and that means that any student, any faculty, any staff member who is affiliated with the university has access to our resources. So you can sign up for our mailing list at matter.health, our website. You can email info@matter.health if you have questions about what's available to you. A couple of notes before we get started. We will have a networking forum following the main event. For those of you who signed up, you will receive an email from Kay Nietzkaj in a few minutes that will include a separate link to click on at the conclusion of the main program. And we will also be dropping the link into the chat function as well for the Zoom. So it's a separate link you have to click on at the end of this program. And if you have questions for the panel, use the Q&A function. All right, so today we have Jennifer Freed, who is the founder and CEO of Explorer Surgical, and we have Adeel Malik, who's the founder and CEO of Clearstep. They will tell you more about their solutions and their journeys in a moment. Our moderator today is Dr. David Beiser. He is an emergency physician and a biomedical engineer. He's the director of the Emergency Trials Unit at the University of Chicago, an associate professor at the university, and he has an appointment as a scholar with the Center for Health Delivery Science and Innovation. He is a startup founder himself. He's a mentor to rising health tech entrepreneurs, and he has a particular passion for using patient-generated data to improve mental health and quality of life. David, I turn it over to you to facilitate the conversation.
Thank you, Stephen. I just want to thank Matter for putting this event on, and also kind of a belated thank you. We were actually, my company was in the first class of Matter companies, and so we were, I think, some of the first tenants as they opened up down at the Merchandise Mart. So. So thank you very much, and welcome everyone to this panel, which I think it's going to be a great panel. This is a group, in the audience that I'm really kind of devoted to, and this is a lot of trainees in the audience, and as an educator, lifetime educator, I'm constantly kind of trying to connect trainees with the future, and I think health tech is a big important part of our future. So we've got the pleasure of working with two very interesting startups today. We've got Adeel Malik from Clearstep and Jennifer Freed from Explorer Surgical. And the way I'm going to structure this is mostly as a conversation. And we're going to start off just with a couple seed questions, but as an audience member, feel free to put your questions into the chat, and we'll try to kind of address some of them if we can along the way. and we might have some time at the end for kind of a more kind of open Q&A. So with that, I'd like to just first start off with a segment that I will all call kind of the founder's journey. And I want to hear from both of you about your journeys and how did you get to the point that you are now, kind of starting with kind of that moment of either inspiration or connection with your co-founder. Jennifer, why don't you start?
Sure. So hi, everybody. I'm Jennifer Freed. I'm the CEO and co-founder of Explore Surgical. We started the company at University of Chicago. I met my co-founder, Alex, who's a head and neck surgeon and operating room researcher in 2013. I was working as a healthcare investor at the time and going to Booth to get my MBA. So I think there are a lot of University of Chicago Booth students and med students here in this audience, which is fantastic. I met Alex through a program called the Collaboratorium that Polsky facilitates, where they bring together scientists and researchers and people that are practicing medicine clinically with business school students, with really the goal of what exactly Alex and I did. So Alex was experiencing a lot of problems himself as a surgeon in his operating room and had a vision for building a software technology to address these problems. So I met Alex through the Collaboratorium, and over a series of 3 years, we actually worked together on a part-time basis, really building out the research foundations of the company, building some very early prototypes. We went through a number of programs at University of Chicago, which I'm happy to talk about more as it's helpful. And then in 2016, so 3 years after we started working together, I left my job as a VC to focus on building Explorer full-time as my career. And so for the past 4.5 years, we've been building our product, taking it to market. We've raised 3 rounds of funding to do so. And I've just been so fortunate to benefit from the wonderful community in Chicago through Matter, through University of Chicago and Polsky to help get us where we are today.
Jennifer, talk to us a little bit about what Explorer Surgical does.
Sure.
What is the value proposition for Explorer Surgical?
Yeah, so we are a digital and remote case support platform for surgery and for interventional procedures. So the initial problem that Alex was facing as a surgeon was variability in his team and variability in the room. So as a surgeon, he had to go in and do a number of different procedures, and he was really reliant on his team. So having the same medical device rep that was there to support the case, having the same tech and same nurse, there's a lot of turnover and a lot of variability in the product. So we ended up seeing issues in the middle of a procedure where he might be waiting 5 or 10 minutes because somebody didn't have something set up properly or they were missing the right instrument. To be honest, when he started telling me about some of these workflow problems, I didn't even believe him.
Right.
And so his vision was, could we bring a digital technology that would really map out best practices for how to do a certain procedure and how to use the different products, and have it available digitally on phones and tablets and screens in the room for teams to be able to interact with to reduce variability. So I saw the problem firsthand when I started spending time in his OR, and we originally positioned it when we went to market as a tool to sell into hospitals, where we could reduce their costs, we could improve operating room efficiency, and along the way ended up pivoting to a different buyer of the product, but still have really deep roots in terms of the actual clinical and financial value propositions to hospitals.
So who's your customer now?
So we sell to medical device manufacturers.
Okay.
We started building kind of the commercial product in 2016 and marketing it to hospitals in 2017. And then it was kind of in 2018 that we signed our first med device customer and really looked up. And I won't spend too much time on it unless it's of interest to the audience, but then it's really pivoted our commercial strategy. So same exact product, but instead of selling it to hospitals, asking the medical device manufacturers to be the ones that paid for it, which we've had a lot of success with over the past 2 years.
So was it that the hospitals, I mean, so it sounds like a wonderful proposition for the hospital, right? So as you discovered that they weren't, at least at this moment, your customer, I guess, what did you discover? Because it sounds like you had a hypothesis that hospitals would care about this. And they, and either they didn't care or they didn't care in time for you.
You know, when I talk about, selling to hospitals, sometimes I feel like I'm just like taking a knife and twisting it, because I still feel so much pain about it. So, when we were selling to hospitals, we had all these very specific days of value propositions. And every time we implemented in a hospital, we delivered on those value propositions. So, and we published studies on it where we could specifically show we reduced disposables waste, we reduced setup time, we reduced intraoperative delays. But what we saw is that commercially, the model wasn't something that was going to work at that time as a venture-backed company. So we saw sales cycles of about 24 months. Okay. And, unfortunately, as an early stage company, you have to show results to your investors every 12 to 18 months to meet milestones to keep getting funding, because it's expensive. And then I think the other thing that we saw were that when we worked directly with hospitals, they treated my team like medical device reps, meaning that, we'd set up the software in their room, but the surgeons we were working with wanted a clinical person from my team there for every single procedure. So, we saw it was really expensive to sell into the hospitals and time consuming, but also, we weren't able to be profitable because of the high level of service requirements. Yeah. So we were able to get in, and we got a half a dozen hospitals up and running. And it was really in that experience, we started working so closely with the medical device reps. So one of the large companies actually reached out to us and said, hey, we see everything you're doing. We see all the value in it, and we have an idea. So we can work with you. We'll license the software from you, but then we already have people that are in the room to support every case. So we can deliver it, and in turn, we're bringing more value. So at some point down the road, maybe we'll go back to hospitals. I still think there is an incredibly strong value proposition, but sometimes that isn't enough. You also have to have the financial and commercial viability if you want to make it as an early stage startup, and you're not part of a corporate entity that has tens of millions of dollars and 10 years to make it work.
Yeah. So two things come out of it. First is that I suspect Steve has arranged many sessions on kind of hospital sales cycles, and so if you want to learn more about that, I would probably look at the Matter schedule, the upcoming Matter schedule, I suspect. But I guess the second thing is that the lesson that I'm hearing from this is that this is a long process, right? You've been doing this now for a good 5 years, and it's not necessarily when you think about yourself as a trainee, you probably hadn't done anything, or a recent graduate from, or in your first job, you probably hadn't done anything really for 5 years before. And so, and I think this is a theme that a lot of the health tech startups that my company started out with, they're just now getting traction. And we started in, 2013. And so, yeah, so it's a long process. Well, great. Adeel, let's hear about your journey and your value proposition at Clearstep.
Sure. So I'll start with just a quick overview of Clearstep. Clearstep is a software that we sell to health systems, so hospitals and health insurers, as well as a couple other segments of the industry, that essentially makes it really easy for patients of our customers or members of our customers to go from the point of, I think I need care, or I'm experiencing symptoms, to getting matched to the exact right level of care within whoever that partner's ecosystem is. So, if it was UChicago, we would kind of configure the way we route patients to all of the various UChicago resources and make it really easy for someone who says, I'm having stomach pain or a headache or whatever it might be, chronic fatigue, to go through a chat-based flow and then get matched to the relevant resource at, say, UChicago. So that's generally what we're delivering. And in terms of value prop for the health system, it's about getting the right people into the right care. There's a ton of inefficiency in that process, and making sure that people who really do need to seek care are getting that care For the payer, it's reducing unnecessary emergency room visits, out of network care, making sure people are accessing care in network. And then the consumer problem is pretty obvious. I think we've all kind of been in a situation where don't know exactly what we should be doing for healthcare, and the docs on the call probably know that all too well, getting calls from family and friends all the time trying to seek advice for what to do for X, Y, and Z symptoms. So that's the basic idea.
Well, I have you there.
Yeah, sure.
So who's your customer then?
So we sell to health systems, usually larger IDNs, and then health insurers as well. But then, this problem of inefficient care routing is not solely like we're working with a telemedicine company, a large national telemedicine company. We're working with one of the largest retail health clinic chains in the country, because they're also similarly trying to tackle this problem. But our main go-to-market focus is around health systems.
Okay, great. Yeah. So I'd love to hear about the journey. Let's, where were
Sure.
you when you were afflicted by this, and
Yeah,
how did you connect with your co-founders?
yeah. So, I'm from Maryland. I went to University of Maryland for undergrad, where I studied finance and neurobio. Was way more focused on the neurobio side through undergrad. I was doing research at Hopkins. I was really intent on going to med school and going into academic medicine. That was really the path that I was charting for myself. And it was kind of senior year of college, post taking the MCAT, getting ready to apply to med school. When I realized, I had spent all this time doing this finance degree, and for seemingly no reason at that point, it's like double the course load for just pursuing the medicine path. And so I thought, let me kind of go into industry for a couple of years before going back into the route that I was anticipating. So I went into healthcare consulting at Accenture, was doing strategy and analytics work there. And like I said, my mentality was, this is a 2-year thing, and after 1.5 years, I'm going to submit my apps and I'll go to med school, and hopefully this industry experience will be relevant at some point in my future career. And things just changed pretty quickly. I found that I really enjoyed consulting. I found like I was learning a lot about how the industry works. I was working with initially pharma and biotech, and then some health systems and payers. And then really it was the last year or so of my career, I was working specifically in the realm of digital health and trying to create a new vertical in the company with a really awesome team specifically for digital health. And now I was talking to tech companies and retail companies about their innovative agendas in healthcare, not the traditional legacy healthcare companies. And so that gave me a lot of insight and planted seeds for how technology is going to disrupt healthcare, and how Google and Samsung and companies like that are thinking about innovating in this space. But it felt like we were far from it. And around the same time, speaking to how I met my co-founder, Bilal is my co-founder, Bilal Naved, and he and I were really good friends since freshman year of college in undergrad, and Bilal had post-college gone on we were on similar tracks to do his MD PhD at Northwestern here in Chicago. And he was really seeing the ground level of the problem that we're solving, even just entering med school in his first couple of years, inefficiencies in care routing and people going to the wrong place for the wrong care, and his own network of family and friends contacting him as a trainee to get advice on what to do for care. So we kind of put our heads together to think through, how can this experience be better? How can we both solve this consumer problem and we knew from the beginning we weren't going to be a direct-to-consumer company, and that we needed to position solving the consumer problem in the context of something bigger, in the context of an organizational problem, so that we can ultimately make the buyer of the solution, the health system or the payer. We knew that from the beginning. We didn't have it figured out really, but we knew we needed to kind of solve both problems in one go. So that's the initial story. There's a lot more to it, right? In terms of what going from idea to jumping ship and actually committing full time and going and raising money, and there's a lot there. And I'll let you, Dr. Beiser, kind of unpack that however you would like.
Yeah. So let's talk about that, Jennifer. Adeel, you bring up something that I think is really important, and this is, I think, very relevant to trainees and people who are in kind of larger either corporate environments or academic environments. Let's talk a little bit about your perspective, the opportunity cost when you decided to actually, make the jump to doing this full time, because for the most part, people don't start off doing this full time. Sometimes they do, but Jennifer, for you, what did the calculus look like when you were thinking about the opportunity cost of kind of throwing everything in as a co-founder to Explore Surgical?
It was scary. I mean, I was in, what I thought was my dream job. I was at a healthcare venture fund. I was on a partner track. I had a great mentor, with one of the managing partners of the firm. It was everything that I thought I wanted my career to be. And I remember actually for months on end, I had a lot of family that had encouraged me, a year actually prior to when I made the decision of, hey, you should jump ship and you should do this company. This is so cool when you get opportunities like this. And I said, no, I'm not an entrepreneur. I'm not a CEO. I'm a finance person. Like, this is what I was meant to do. And I have this great job and it's all that I've ever wanted. And I remember actually for a couple months, I kept notes on my phone. And every morning when I woke up, I'd say, well, what is my gut instinct? Do I stay at this VC fund or do I stay at the company? And it was probably 50-50. And ultimately what it came down to was we had come out of an SBIR phase 1 and phase 1B, and had gotten really good results. But in order to build a commercial scale product, we needed more money. And I went around and talked to different seed funds and early stage investors. And the feedback that I kept getting was, hey, this is a cool idea, but we're really not interested unless you're the person that's driving the ship. And I ended up seeing it as, this is a necessity, and either I let this go and it was a side project and that's all it's ever going to be, or I can step up to the plate and take the risk. And I took a 75% pay cut from what I was making a year out of school. And it was a really big decision. I'm so happy I made the decision. I'm learning so much every day, more than I ever would in anything else. But I guess the story has yet to be written if it was the right financial decision for me. But long term, I'm so happy doing what I'm doing. But it took me a while to get comfortable with that.
Yeah, well, Jennifer, I think you bring up a really interesting point that certainly resonates with me. When I started my company, it was academic faculty, tenure track, who'd already been at the university for several years, family and three kids, and ultimately could not commit just because of the risk involved at the time.
My co-founder couldn't either.
And that's an important thing. And I think when we were out looking, to raise money, the fact that I was kind of the main kind of product person, I think spooked investors, that I was, I didn't have both feet in. I had one foot in. And actually, as it really say that I'll get in trouble with the university. So, I can have like a 12% foot in, or something, like 12% of my body in this endeavor, something like that. So that's a key. That's kind of a key thing, is kind of committing. Adeel, how about you? What was going through your mind as you decided to do this full time?
Yeah, the thought of becoming an entrepreneur never crossed my mind in college, even through my consulting experience. But towards the end, or at least through the majority of my consulting experience, towards the end though, as I mentioned, I was like learning so much about outsiders to healthcare and how they were thinking about innovating in healthcare, and really kind of saw that in talking to a lot of the big technology players, I didn't believe that true innovation was actually going to come from there. Whereas as I started studying up more, saw that the startup ecosystem was really driving the kind of new ideas and new models and new technologies, and that those get snatched up by big players, quite often. But that was really the source of innovation. And one thing I would highly recommend to any students or anyone really who's interested in starting a company when you have ideas is apply to competitions, apply to accelerators and competitions, because that is ultimately what kind of knocked over the domino for me. And it was super helpful from the point of, we have this idea, we're not exactly sure what even questions we should be answering, right? In terms of business model, especially not having been an entrepreneur before. And so writing up, so we decided, me and my co-founder, we decided we're gonna apply to Y Combinator, and we're gonna use that. If we get into YC, great, like off to the races. I'll leave my job, like that was kind of what we'll have initial capital to be able to pay ourselves and pay for rent, and that'll do it. But the exercise of even completing the application was so useful to just like flesh out the idea. And so that's a great way, whether or not even you apply, just like looking at the questions that are asked and trying to draft responses is really worthwhile. And ultimately we got to interviewing at YC, but we didn't get it. Yet that trip that we made out to San Francisco, on that trip, we had, like 20 plus meetings with other VCs and things that we had people we had lined up to talk to. And despite not getting YC, I became so confident through those other conversations, meeting with big VCs and that we were able to line up while there, that there was really something here, that we were really on to something, and it was going to take one of us just fully committing at least to start, to drive it forward. I was just so excited about it after those experiences. But yeah, ultimately it was applying to accelerators and startup competitions that like helped create that confidence.
Building on that, I'd say too, for those of you that are in school, it's a really great lower risk environment to think about starting a company. Because if we do start to think about the opportunity cost, like Dr. Beiser has been framing it, you have a lower opportunity, the cost is lower while you're in school because you don't have to leave something full time. And, in particular, University of Chicago as an institution has so many programs that are really designed to facilitate, step by step, how do you take an idea and turn it into a company? So, we went through a National Science Foundation I-Corps, which gave us a small grant to do our initial customer discovery work. We went through the University of Chicago Innovation Fund that gave us that next grants that helped us get started. We then went through, we did the SBIR program in conjunction with the University of Chicago. And I sometimes sound like a walking and talking ad for the Polsky Center, which I'm fine with, because there's so many programs there. And the nice thing about healthcare is there's so much research funding that's available that's non-dilutive that you can take advantage of to help you get your company off the ground. So I encourage everybody here that, is a student, or if you're in training, to take advantage of all of these resources and opportunities that you have to start to explore areas that you're excited about, because that can help give you some of the data and information to really assess the viability and start to take a little bit of the risk off the table.
Yeah, no, I think it's really important. It's a great way to dip your toe in the water. I certainly, when I was thinking about my health tech startup, back in the 2011, I was starting to think about things like that. I went to many different, just hackathons. I went to a 2-week hackathon at MIT Media Lab. I was that kind of like committed to doing this, and ended up at a Techstars accelerator where, yeah, you just learn how to kind of talk to different stakeholders. You have 100 meetings, and it's such a quick education. And even though like my startup went sideways, it's transformed my career and what I do. Kind of, I've kind of taken lessons that I learned in entrepreneurship and have kind of translated them back into academics, and changed the way that I do my work. And it's a very low risk thing. Yeah, trip to San Francisco. We don't actually have to go to San Francisco anymore because we have Matter. But at the time, yeah, you had to go to San Francisco or Boston. But now there's just so many things going on here in Chicago. So let's shift gears a little bit. Now I want to, keep track of our time here, but I wanted to talk about, and we've already kind of talked about kind of some of the university programs, but I'd really like to talk about kind of how you build your teams. Okay, and as an early phase startup, how do you kind of add non-founder team members, and what does that look like briefly, and then we'll kind of talk about how we get trainees and students involved. Jennifer, how about you?
Sure. So, the first hire that we made was our chief technology officer. So, our founding team was really myself and Alex. So I was the business and financial person, and Alex was the surgeon who really was the subject matter expert, and I think the visionary behind the product. But for us, wanting to build a software company, neither of us actually had computer science backgrounds. So that was our first hire that we made. And it's funny, we had heard so many people say, oh gosh, it's really hard to find, great software talent in Chicago. And we had the total opposite experience. We ended up going through 1871. So this was in 2015. So it was kind of right when Matter was getting started. And now I'm sure you can find healthcare specific software people much more easily. But we ended up getting a great, set of candidates and hired somebody that we met through 1871, who's still our chief technology officer today. But what I'll say is that, the first hires are not necessarily, one FTE, right? So the first thing that we did was use some of the grant funding, and we actually hired a computer science student part-time and paid him hourly to build, the very first prototype. The second thing that we did was, we kind of knew how we wanted it to operate, but we needed to design the look and feel. And we ended up hiring a UX firm in Chicago and paid them 30 grand to basically build a landing page for a website, but it would give the people in the OR the look and feel of what it was going to be. And then, we hired Eugene as our chief technology officer, but we worked with an offshore development team to lower the costs. So there's a lot of kind of step changes in terms of the investment level of the team that you build over time.
Adeel, was that similar in progression for Clearstep, or were there any major differences?
No, I mean the general theme is similar, of just like I think the core principle is really mapping out where you need to get to in whatever period of time, next year, 18 months, and like what objectives you're trying to achieve, and then what roles you really need to fill from there, and whether those are part-time contributors you can pay as contractors, offshore developers, or you need to go hire a full-time person to do it. That kind of becomes clear through those kinds of exercises. But what's critical is to hire non-founder talent, you need capital, right? Before raising any money at the idea stage, if you're bringing people in to the company to work on it with you, it's a much different dynamic, right? Either they're an advisor and they have very limited involvement, and you give them some shares, or you bring them in as a co-founder if they're that critical of a role, or they bring that critical of a perspective, and you give them what look much bigger pieces of the pie, right? And so in order to actually justify early non-founder hires, like, you need to be able to pay maybe not market salaries, but pretty decent salaries, which requires lining up funding and that. So it largely depends on what stage you're at. For us, we had actually a 4-member co-founder team. We brought on 2 other co-founders that filled specific skill sets that we needed early on before we could pay people, right? A CTO and someone to work on user experience and design and product.
Willing to work for equity. Exactly.
Yeah.
Right. So let's talk about students and trainees in particular, Adeel, kind of as
Sure.
We're still on you. So how have you worked with students or trainees, if at all? And
Sure.
And how do you kind of develop those relationships?
Sure. So Casey, might be a good time for you to enter the fold here, but I think the most or one of the best examples is Casey, which is why we brought him onto this call with us, because we basically have a clinical content kind of division of the company where we have a bunch of part-time clinicians working on creating and developing brand new clinical content that we feed into our technology. And just as we were starting to do all of that work, I got kind of just coincidentally connected to Casey, who I'll let intro himself here in a minute, but is an emergency medicine resident with Dr. Beiser actually at UChicago. And Casey was very self-motivated. I think he had come to a Matter event. He was trying to look into getting involved in the startup community. I got connected through another Matter founder to Casey, just a note, hey, if you guys are looking for clinicians or anything like that, like here's someone that might be interested. And the rest is history. Casey is a very active contributor to Clearstep and sets aside a significant amount of his time on a weekly basis to work on Clearstep and driving it forward. So maybe Dr. Beiser, if it makes sense to you, maybe it makes sense to allow Casey to kind of give his perspective as a medical trainee, getting involved in the startup world.
Yeah, Casey, I'd love to hear about that, and maybe any advice you have for our trainees in the audience.
Yeah, sure. Thanks, Adeel. Thanks, Dr. Beiser. Briefly for me, I'm a third-year emergency medicine resident, University of Chicago, and I'm also on the clinical content team under Adeel's leadership at Clearstep. And I think very briefly, what got me interested as I was starting residency and going through the first 3 years of training, I'm seeing patients. I love that overall delivery of healthcare, but outside of those patient interactions, I wanted to find other ways to get involved. Through a couple friends who were at Booth at the time, being connected through Matter, I found out there's some really great health tech opportunities that were happening here in Chicago. And being part of the university or a resident physician puts you in a unique opportunity, certainly, to say, well, what are those opportunities? What are companies doing? What's out there that maybe you can get involved with and use your skill set? Yeah. And for me, that was somebody who was very excited in trying to get into health tech and was learning to be a physician going through residency. And as Adeel mentioned, it started with me reaching out to anybody I knew in the space and trying to just kind of hang around the business school and Matter and find out what ideas were out there. Something I encountered was similar to what Adeel alluded to. And every family member, once you are in medical school or a physician or anything related to healthcare, starts to call you and ask for advice on what should I do. It's 2 o'clock in the morning. Do I go to the ER? Can I wait till tomorrow? What does this mean when I have a fever? What do we do next? And I thought, gosh, we see so many patients walk into the ER that maybe don't need to be there, or what advice would I give to a family member? And what about the millions of people that don't have that direct access to a physician? Is there some in between? How can technology help us with that? Sure enough, I'm speaking loudly about this. Someone hears and said, hey, Clearstep's doing something really similar. You should try to get involved.
Oh, I didn't even know that.
Yeah. That's how it started. And that's kind of where it was. It's what is it that you're interested in? Is there a problem you're finding in your daily job that you want to be involved with or learn more about? And that's kind of what it was. I started bugging Adeel, and he was nice enough to let me learn about the Clearstep team. And I just offered my advice initially and said, hey, how can I just learn about the company, learn about the space, give some free time up front just to see what's going on and try to get involved. So that was maybe briefly where we started and how I got involved.
Casey, I think you bring up a good point. There is a fair amount of investment that has to happen kind of on the, because as a trainee, you bring enthusiasm and you bring great ideas, but experience is usually lacking. But usually that can be mitigated if you're, with enough hard work. But there is a fair amount of just kind of sweat equity that needs to kind of go into this. And I even found that as an experienced clinician, as I was getting involved in the entrepreneurship community, that I had to just have a lot of conversations and actually engaged with some startups, donated some time, and just to kind of understand things a little bit better, and see if this was something that I wanted to do. So you do need to actually kind of donate time, but at some point you need to formalize a relationship. How did you negotiate that kind of transition, Casey, like from a volunteer trainee to, hey, I think I'm doing something that's taking a lot of time and is adding value to the company? And how do you do that in an informal kind of startup environment?
Yeah,
As
you're
an
totally right. I think in that beginning, the first several month phase, even, it's just about, gosh, you spending all your free time trying to do this thing or learn more about something you don't know much about. So it's meetings, it's asking people, it's jumping on phone calls or emails, or showing up at whatever it is, a business school, a local place. And it's all your time because you want to learn more about it. And when I first approached Adeel, I said, I don't even know what skill set I have to offer you exactly. I just know that I'm here and I want to be involved. And I think that's how it was for the first 3 to 6 months. And then it was about developing relationships. I was able to say, look, outside of my clinical time and this job that I do full time at the hospital, I'd rather spend all my other free time getting excited about this new opportunity. And I'm willing to show that to Adeel, to Clearstep, because I'm here because I want to be here, not because I have to be here. And I'll dedicate any time I can. In terms of then taking it the next step, once Adeel and I think, realized that, hey, we work well together, and there are a lot of things that even as a senior resident in emergency medicine, as opposed to somebody who's been practicing 10 to 20 years, you do have something to offer, certainly within that clinical realm, and trying to bridge patients to healthcare, because there's not that many people in that space. And then it was about, well, is there consulting type work? I'm sure Adeel could speak to this more, but it was saying, I can't leave my job full time, but maybe there's something we can put on paper. How do we draft up a consulting agreement? How do we talk about an NDA? Because I'd love to be involved on a little bit more formal basis, and I'm happy to give more time. And part of that for me in signing a consulting agreement was also my dedication to the company as well. So I think it kind of went both ways. One, it was to be compensated for your time, and it was also to show your commitment to this company that you'd started to initially as kind of a hobby or your free time, to say, hey, no, I really want to take the next step. That's what it was for me. It was initially lots of conversations, talking about the industry, doing some background research and literature review that I could present to Clearstep, and then moving into a more consulting role after that.
And so, Casey, we haven't talked about this. I feel bad that we have. Or next year, how is this affecting your plans for next year? Or is that still up in the air?
Yeah, totally. So sorry, I don't mean to speak too much, but what I was doing in the hospital, and I still do, and what I'm going to do this afternoon, is seeing patients. And I love that. And I knew that was my primary goal. But what really gets me excited about that was learning about this other realm and being involved in a health tech company. And that was something I just didn't get experience doing in medical school. I didn't get experience in the emergency department. So Clearstep has been incredibly invaluable for that. So I continue to stay on with that. And it also helped me find my next full-time role, and that's as a clinical informatics fellow. So I'm going down to Nashville at Vanderbilt University to work in their emergency department to learn more about the field of healthcare and technology through clinical informatics. And I owe a lot of that interest and getting my foot in the door and understanding the world a little better through Clearstep. And that's sort of what took me from my residency to fellowship. And obviously, hopefully, I can stay on with Clearstep as long as Adeel keeps me.
Oh, for sure.
Adeel, we're going to talk, but I think maybe you might have to start talking about equity with Dr. DeTasso because you're not going to be able to afford him pretty soon when he finishes his fellowship. Jennifer, have you worked with trainees? Has Explorer Surgical worked with trainees, and how have they kind of navigated those relationships?
Yeah, we have, and it's definitely evolved over time. So early on, we actually had a similar need for content development. And we would work with med students or surgical residents. We would have, I think, a group of anywhere from 4 to 7 at one time that we actually paid hourly to work with our team. So we've done that, and that was fantastic. We've had other points and times where we've wanted to have consulting relationships with specific surgeons, and sometimes it was attending surgeons. We loved working with residents when it was with respect to kind of surgical content. Because residents were a little bit more affordable, to be honest, for us. Attending physicians, usually had a very, very high hourly rate that they wanted to be paid, which was out of range for us at the time. But it was kind of mutual learning and worked on all fronts. And then now we actually just started a formal clinical advisory board where we have senior surgeons and proceduralists that we work with that are compensated primarily in equity. When I'm speaking out of turn with this. So different kinds of relationships, throughout the journey, and different types of compensation structures, really depending on that relationship. But, you just have to find what works for both parties. And I'd encourage, anybody that is thinking about, getting involved, if you're on the clinical side, I would take a couple meetings first and see if this is something that you're really serious about. And I wouldn't be afraid of, giving away your time for a couple hours, because it's also what helps build your reputation. And there's a network effect of kind of doing good and passing it along. But there does come a point in time, like Casey said, where it's, okay, I'm not going to keep spending 5 hours a week with you. Like I really want to have an incentive and be motivated alongside you. And then you have to have that conversation and figure out what works.
That's great. Okay, so we're getting close. We're about 10 minutes to the end of the program. I wanted to leave some time for Q&A from the audience. And so Casey and Sam, I don't know if there are questions that you want to elevate from the chat.
Yeah, absolutely. We actually got a great question in the chat. It says, not to put Jennifer and Adeel on the spot, but long-term, what is your plan or vision for Explorer or Clearstep?
Yeah, I can start. I mean, I think, you can plan for the long term, but in early stage companies, you really have to be most focused on, hey, what am I going to do in the next 12 to 18 months, right? But the number one job of the CEO is to keep the lights on, which means that, you need to have funding of some kind, ideally through revenue for customers, but until you're in the black, you need to keep fundraising. Right now we're actually planning another fundraising round. We're really focused on just continuing to grow our user base. We think at the right time, the exit will come. We do want to deliver a return to our investors, but, I think we need to hit some specific commercial milestones first, before we start to go in that direction. So that's kind of our primary mandate, for the next 24 months, is just continuing to grow our medical device customer base, grow the number of procedures that Explorer is used in, and just continue to kind of move forward with the mission of the company.
Yeah, and I echo everything Jennifer said. I mean, we are Clearstep. 2020 was a really huge year for Clearstep. Largely driven by COVID, where before March of 2020, we were really, when we would pitch the idea of care navigation or the need for digital triage, our stakeholders knew it was important and knew it was coming, but they still considered it kind of an innovative idea that was maybe down the line. Whereas making sure people who really needed to go to the ER were going, who couldn't do care at home virtually, were doing so, or were just treating themselves with self-care, that became of critical importance through COVID, and it really pulled kind of the future forward for us. And so when we think about like exit potential or what's going to happen, for now we're really focused on 18 to 24 months of growing as much as we possibly can, and holding true the I think the North Star here of really trying to have an impact and make a dent in access to care for as many people as possible. And so if that means continuing to grow as an independent organization and grow really quickly, which we've been in a pretty high growth phase ever since COVID started, and are continuing kind of on that trajectory, over at least projected over the next 24 months. If that happens and continues on independently, or if the right kind of acquisition came across where we're still able to pursue that mission and that vision and reach more patients and reach more consumers, then maybe that will be the right thing to do. But ultimately, I think bringing it back to the value that you're trying to drive and focusing on doing the most you can to pursuing that mission is like what we try to do, and we'll see what opportunities come along the way.
Great. And I guess kind of along that line, as we're like looking into the future, if you had to have like one prediction in kind of the health tech field for the next year, for 2021, what's one prediction about about health tech that you're just kind of, you've been just kind of thinking about, and you know, what's at the top of your mind thinking about the future of health tech and its expansion or decline in the next year?
You want to go, Jennifer?
Oh, sure. I think my big prediction is that, you know, remote is really here to stay in healthcare. So, you know, I think if you look at, there was so much resistance to telehealth prior to 2020, and this unfortunate situation, the pandemic, has gone on so long that I think it's really become the norm. And so, you know, we saw things that were impractical become impossible, but that doesn't mean that they aren't still impractical. And so I think you're going to see healthcare practitioners and patients and everybody involved in the healthcare ecosystem start to really evolve new models for care that are lower cost and more convenient. And you're going to start to see a huge swell of new companies embrace this.
You know, the number of digital health companies that have suddenly become kind of telehealth, or, you know, basically telehealth, kind of telemedicine companies, is amazing. I've seen a lot of companies that weren't doing telehealth that just kind of all of a sudden they tack it on to their solution, and they're profitable, or not profitable, but at least they're making money now because they've got a way to kind of to get paid. Adeel, how about you?
Yeah, I think very much related to what Jennifer said. What I think we're going to see, and we're already seeing, but see more of, is virtual care expanding its scope, right? So historically, virtual care in the early days of it, and even up till 12 to 18 months ago, was really just focused on like urgent, small, minor issues that you might be able to handle at an urgent, and basically urgent care related conditions or presentations. That weren't like cuts or laceration, right? Like things that you could just hit. So now what we're seeing is a huge force behind accelerating things like virtual primary care, other kinds of specialty care being delivered virtually, and with kind of remote monitoring and devices that can be used at home. That's just going to continue even further, right? So the Teladoc Livongo merger is one great example, right? Like Livongo really focused on monitoring chronic care conditions over time. Teladoc having a great expertise in delivering care virtually, bringing those together is a real signal for what's to come in more and more types of care being delivered at home virtually with something that's sent to you, or an ultrasound that's sent to your home. And the cool thing is, like, when we think about the future of Clearstep, as more and more care can be delivered virtually, you need more intelligent routing to be able to say, well, you actually don't need to go in person, you can handle this virtually, or at this time you do need to go to Quest to get a lab test, and then those results can be sent to a virtual care doc. There needs to be, it almost underscores the need for intelligent care navigation, because the field of resources becomes even more complex, because now you can deliver more care virtually. So
I think both of your companies are really well positioned for kind of the expansion of virtual care or care at a distance. I was reading about a company recently that's doing, you know, virtual emergency care, right? So if you can do virtual emergency care, you can do almost anything, right?
Right.
You know, short of like maybe trauma care might be but so I agree completely. It's here to stay. So we're going to need to wrap up. I wanted to just remind people, well, first, two things. There's all sorts of programming available on the Matter website, but also the Polsky Center has, at University of Chicago, has all sorts of offerings. There's the Entrepreneurship Essentials course. There's a mentorship program. There's Polsky On Demand. It's kind of a new online portal to connect entrepreneurs to workshops and experts. And then I want to remind everyone about the virtual networking session that will occur immediately after this session, and there should be a link in your email for that. So with that, I'll wrap it up. I don't know if Stephen or anyone else wants to have any closing comments. And I want to thank the panelists and Matter and Polsky, of course.
Thanks for having me.
Awesome.
Yeah, thanks.
Thank-
Yeah, thanks so much, David, for moderating a great panel, and Jennifer and Adeel, really appreciate your insights, and thanks everybody for joining us.